When it comes to finding effective treatment options for Parkinson's disease and influenza, Amantadine emerges as a promising solution. With its wide spectrum of benefits, this medication offers hope to those battling these debilitating conditions. Understanding Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that affects millions of people worldwide. It is characterized by the progressive loss of dopamine-producing cells in the brain, leading to a range of motor and non-motor symptoms. These symptoms include tremors, rigidity, bradykinesia, slowness of movement, postural instability, and difficulties with balance and coordination. As the disease progresses, patients may also experience cognitive impairments, depression, and sleep disturbances. While there is currently no cure for Parkinson's disease, various treatment options are available to manage its symptoms and improve quality of life. One such option is the use of Amantadine. How Amantadine works for Parkinson's disease. Amantadine is an antiviral and antiparkinsonian medication that has been used for decades in the treatment of Parkinson's disease. It works by increasing the release of dopamine in the brain and blocking the reuptake of dopamine, thereby enhancing the availability of this neurotransmitter. By doing so, Amantadine helps to restore the balance between dopamine and other neurotransmitters, improving motor function and alleviating symptoms. In addition to its effects on dopamine, Amantadine also acts as an NMDA receptor antagonist. This means that it blocks the activity of the NMDA receptors, which are involved in the transmission of pain signals. By inhibiting the NMDA receptors, Amantadine can reduce the intensity of pain experienced by individuals with Parkinson's disease. Efficacy of Amantadine in managing Parkinson's symptoms. Numerous studies have demonstrated the efficacy of Amantadine in managing the symptoms of Parkinson's disease. In particular, it has been shown to be effective in reducing tremors, rigidity, and bradykinesia, which are hallmark symptoms of the condition. By targeting the affected parts of the brain, Amantadine helps to restore normal movement and coordination, allowing patients to regain control over their motor function. One study published in the journal Neurology found that Amantadine significantly improved motor function in patients with advanced Parkinson's disease. The researchers observed a reduction in dyskinesias, abnormal involuntary movements, and an improvement in overall motor scores. Another study published in the Journal of Neurology, Neurosurgery and Psychiatry reported similar findings, showing that Amantadine led to a significant reduction in dyskinesias and improved motor function in patients with Parkinson's disease. Furthermore, Amantadine has been investigated for its potential neuroprotective effects in Parkinson's disease. Preclinical studies suggest that Amantadine may have the ability to protect dopaminergic neurons from further damage, potentially slowing down the progression of the disease. While more research is needed to fully understand these neuroprotective effects, they hold promise for the future of Parkinson's disease treatment. Potential side effects and precautions of Amantadine. Like any medication, Amantadine is not without its potential side effects. Common side effects include dizziness, lightheadedness, nausea, and dry mouth. These side effects are generally mild and tend to resolve on their own, but it is important to discuss any concerns with your healthcare provider. In some cases, Amantadine may also cause more serious side effects, such as confusion, hallucinations, and changes in mood or behavior. These side effects are more common in older adults and may require medical attention. Additionally, Amantadine can interact with certain medications, so it is crucial to inform your healthcare provider about all the medications you are taking to avoid any potential drug interactions. Amantadine should be used with caution in individuals with a history of seizures, heart disease, kidney problems, or psychiatric disorders. It is important to follow the prescribed dosage and adhere to your healthcare provider's instructions to minimize the risk of side effects and ensure the medication is effective in managing your symptoms. Amantadine as a treatment option for influenza. In addition to its use in Parkinson's disease, Amantadine is also a recognized treatment option for influenza, a highly contagious viral respiratory illness. It belongs to a class of medications known as adamantanes, which have been used for decades to prevent and treat influenza A infections. When taken within 48 hours of symptom onset, Amantadine can help reduce the severity and duration of influenza. It works by inhibiting the replication of the influenza virus, preventing it from spreading and causing further damage to the respiratory system. However, it is important to note that Amantadine is only effective against influenza A viruses and is not effective against influenza B viruses. It is worth mentioning that the efficacy of Amantadine in treating influenza has declined in recent years due to the emergence of drug-resistant strains of the virus. Therefore, it is recommended to consult with a healthcare provider to determine the most appropriate treatment options for influenza based on the prevailing strains in your region. Comparing amantadine with other medications for Parkinson's disease and influenza. While amantadine has shown efficacy in managing the symptoms of Parkinson's disease and influenza, it is important to consider other treatment options and their respective benefits. In the case of Parkinson's disease, there are several medications available that target different aspects of the disease. Levodopa, for example, is considered the gold standard for Parkinson's disease treatment. It is a precursor to dopamine and helps replenish the brain's dopamine levels. Levodopa is often combined with carbidopa, which enhances its effectiveness by preventing its breakdown before it reaches the brain. Other medications, such as dopamine agonists and MAO-B inhibitors, are also commonly prescribed to manage Parkinson's symptoms. As for influenza, there are several antiviral medications available, including oseltamivir, Tamiflu, and zanamivir, Relenza. These medications work by inhibiting the neuraminidase enzyme, preventing the release of new viral P videos and reducing the severity and duration of influenza symptoms. They are effective against both influenza A and B viruses and have been widely used during influenza outbreaks. The choice of medication will depend on various factors, such as the individual's specific symptoms, medical history, and potential drug interactions. It is important to consult with a healthcare provider to determine the most suitable treatment option for your condition. Dosage and administration guidelines for amantadine. The dosage of amantadine will vary depending on the individual's condition and response to treatment. It is typically initiated at a low dose and gradually increased to achieve optimal symptom control. Your healthcare provider will determine the appropriate dosage and provide specific instructions on how to take the medication. It is important to take amantadine exactly as prescribed and not to exceed the recommended dosage. Abruptly stopping the medication can lead to a worsening of symptoms, and it is advisable to consult with your healthcare provider before making any changes to your treatment regimen. Amantadine is available in different formulations, including immediate-release tablets, extended-release capsules, and oral solution. The choice of formulation will depend on factors such as convenience, tolerability, and individual preferences. It is important to follow the specific administration instructions provided by your healthcare provider or pharmacist to ensure optimal absorption and effectiveness of the medication. Latest research and developments in the use of amantadine. As research in the field of Parkinson's disease and influenza continues, new developments and advancements are constantly being made in the use of amantadine. One area of interest is the potential use of amantadine in combination with other medications to enhance its efficacy or target specific symptoms. For example, studies have explored the combination of amantadine with levodopa to improve motor function and reduce dyskinesias in patients with advanced Parkinson's disease. The combination therapy has shown promising results in reducing OFF periods when medication is less effective and improving overall motor function. Another area of ongoing research is the neuroprotective effects of amantadine in Parkinson's disease. Preclinical studies have suggested that amantadine may have the ability to protect dopaminergic neurons from further damage, potentially slowing down the progression of the disease. Further research is needed to fully understand these effects and their implications for the treatment of Parkinson's disease. In the field of influenza, researchers are actively working to develop new antiviral medications with improved efficacy against both influenza A and B viruses. These medications aim to overcome the issue of drug resistance and provide better treatment options for individuals with influenza. While amantadine remains a viable treatment option for influenza, it is important to stay informed about the latest developments and consult with a healthcare provider to determine the most appropriate treatment strategy. Conclusion: the future of amantadine in treating Parkinson's disease and influenza. Amantadine has emerged as a promising treatment option for individuals with Parkinson's disease and influenza. Its ability to target the affected parts of the brain and restore balance and coordination makes it an effective tool in managing the symptoms of Parkinson's disease. Additionally, its antiviral properties offer relief for individuals battling influenza, reducing the severity and duration of the illness. While amantadine is generally well tolerated, it is important to be aware of potential side effects and precautions. Consulting with a healthcare provider is crucial to ensure the medication is suitable for your specific situation and to monitor for any adverse effects or drug interactions. As research in the field continues, the full potential of amantadine in treating Parkinson's disease and influenza is yet to be fully realized. Ongoing studies exploring combination therapies, neuroprotective effects, and advancements in antiviral medications hold promise for improving treatment options and enhancing the quality of life for individuals affected by these conditions. If you or a loved one is seeking effective management for Parkinson's disease or influenza symptoms, Amantadine may be the solution you've been searching for. Consult your healthcare provider to discuss its potential benefits and suitability for your specific situation. Together, you can make an informed decision and embark on a treatment plan that offers hope and improved quality of life. Thanks for watching.